In this video, I will be reviewing what is a heart attack, which is also known as a myocardial infarction. We will be reviewing a background about what a heart attack is. We'll talk about risk factors, diagnostics, clinical symptoms, along with nursing interventions. So let's begin. Hi guys, it's Nurse Aleen from Go Nursing RN. So let's talk about heart attacks. What is a heart attack? A heart attack usually occurs when a blood clot blocks the blood flow to the heart. Due to decreased blood supply, the tissue will then be deprived of oxygen that will lead the myocardial cells to die and a lot of times develop necrosis. This is also known as a myocardial infarction, and in nursing school you're going to see that they're going to call it MI. Most myocardial infarctions are going to be due to an underlying coronary artery disease, and it is one of the leading causes of death in the United States. You're going to see that a lot of patients come into the hospital with chest pain and different kind of clinical manifestation that revolves around having a heart attack. Now, a quick recap of the blood supply of the heart. You want to understand that the blood is going to be carried by the coronary arteries. These arteries are extremely essential because they are going to split between the left and the right side of the heart, actually perfusing oxygen to the heart, which we know that it's a muscle and every muscle needs oxygen. The blockage that happens in the left coronary artery a lot of times is going to cause the worst damage from a myocardial infarction. The left coronary artery blockage can lead to an anterior wall death, which will affect that left ventricle significantly. And we all know the left ventricle is going to be extremely important, as that's where the blood is going to pump out into the aorta and into the body. So it is important to keep in mind that a heart attack results from blockage of the blood flow. When the demand of the myocardial oxygen exceeds the ability of the coronary arteries to supply the heart with oxygen, the key symptom that the patients or clients are going to have is going to be chest pain. It is also known as angina. That's going to be another name for chest pain. It is caused by either an increased demand of oxygen, the heart is saying, I need oxygen, or decreased supply of oxygen, given that there's something blocking those coronary arteries. Some common risk factors to keep in mind is associated with coronary artery disease, which is pretty much high cholesterol or plaque that builds up within those coronary arteries. Coronary artery disease is one of the number one factors that lead to a heart attack, also known as the MI, right? So with coronary artery disease, this can be a chronic disease or it can be progressive. Patients may have asymptomatic chest pain for many years, and they have kind of developed something called chronic stable chest pain, which means that they get the chest pain, they take a nitroglycerin, they rest, the chest pain goes away. Right, so it's more chronic. However, until a certain point of percentage of blockage that chronic turns acute and leads to that heart attack. Other risk factors are going to be grouped by non-modifiable and modifiable risk factors. Now, the non-modifiable risk factors, fortunately, we can't control them. Age, right? We can never be 21 forever, right? Gender, ethnicity, family history, and also genetic inheritance. Modifiable ones we do have control over are eating habits, hypertension, cholesterol levels, smoking, being inactive, or obesity. Those are all things that we actually can control. When we think about heart attacks, we want to think of the key symptom to watch out for. First one that comes to all of our mind is going to be chest pain. Right? And as I mentioned, it's also known as angina. Although most chest pain is going to occur in that substernal area, it can radiate to other locations, which includes the jaw, the neck, the shoulders, and the arms. Usually it's going to be that left arm. Some patients, especially women, will report atypical symptoms. One of those includes dyspnea, nausea, abdominal pain, and fatigue. Now, in severe cases, patients are going to be extremely short of breath and possibly lose conscious, lose a pulse, and go into cardiac arrest. Now, once a patient comes in to the ER, for example, say they are complaining of 10 out of 10 chest pain that is radiating to their left arm and their jaw. There are a couple key diagnostic tests that we will need to have done to evaluate for a myocardial infarction. First thing we want to do is start with a 12-lead EKG. Now, a lot of you have most likely seen maybe a 5-lead EKG, but a 12-lead EKG allows us to see the different viewpoints of the heart and see if there is something called an ST elevation. That would signify that the patient's having a STEMI, and that means there's a full occlusion in the coronary arteries. At this moment, time is of the essence. We will need to revascularize that blocked artery, which is going to be done by the cardiac cath lab team. We want to get that patient into the cardiac cath lab, get a cardiac angiogram, which they're going to go ahead and put a catheter in through the groin and be able to see where the blockage is in that coronary artery and place either a stent or an angioplasty to make sure that we reperfuse the coronary artery that is blocked. Other diagnostic tests include troponin. Troponin is a lab test, which is pretty much going to be a protein that is found in just the cardiac muscle. However, this protein, troponin, will be released in the bloodstream at times when the heart muscle is under stress. So you can just imagine the heart screaming for help, so it's going to secrete this troponin into the blood vessels. Another lab test would be myoglobin and CKMB. Patients can also have a chest x-ray, of course, and another important one could be an echocardiogram. This will give us an ultrasound image of the valves, the ventricles, the atrium, and get the ejection fraction, which is the percentage of blood that's being pumped out of that left ventricle. So let's talk about some nursing management interventions with patients that are having a myocardial infarction. You can see that this is a very serious situation that a lot of nurses are going to be placed in because we want to ensure that we're taking priority interventions to decrease the oxygen need of a compromised heart muscle. We want to reduce the risk of any further complications. The faster we get the patient into cardiac cath lab or the faster we get them onto any thrombolytics, we can save that tissue for a lot of these patients. An acronym to remember is MONA. So the first thing we want to initiate a lot of times is going to be giving drugs such as morphine, which will help vasodilate and help with the pain. Put the patient on supplemental oxygen as needed to eliminate or reduce chest pain. Nitro is going to be a medication of choice to vasodilate and pretty much decrease that oxygen demand, and give them aspirin, right? Aspirin is going to be key to give as well. We want to maintain a continuous EKG in all departments that the patient is in. So if they're in ED, we want to monitor them closely there. They possibly will move to ICU and then up to the next med-surg unit. So we want to keep them on EKG monitoring at all times. Dysrhythmias can definitely happen and they need to be identified quickly and treated. Right? So these patients can go into these lethal dysrhythmias, lose the pulse, and have a full-on cardiac arrest. In addition, of course, you want to take your routine vital signs, monitor intake and output, make sure they have good, adequate urine output. We want to make sure those kidneys are working, right? And last but not least, it is important to promote rest and comfort with any degree of heart damage. Bed rest may be ordered for the first few days after having a heart attack, especially if it involves a large portion of the left ventricle. However, a patient will then need to start rehab. We need to start getting them up as long as they're safe, get them moving, get them to at least rest in the chair. As much as the doctor has ordered that is okay for the patient to do, we want to advocate them and get them up and going. If you found this video helpful, don't forget to like and subscribe here below. Check out my EKG video here above, as it's going to really help you understand various dysrhythmias that can occur. Also, leave in the comments section other nursing topics you would like me to discuss. See y'all next time.